Okay.
Okay.
Welcome, everybody. My name is Marty Mascari. I'm the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both of those are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We are blessed once again to have our partners, my cohorts with the Area Agency on Aging, Melinda Gardner and Felicia Warner, and then also our partners at the Better Business Bureau Education Foundation out of Houston. We have Angel here with us. But before we get started, we're going to talk a little bit about CEUs. I do want to make the point that even though we advertise this as a morning and afternoon session today, we are only doing a morning session. I've tried to notify everyone of that, but we will not be on this afternoon. So for those of you that might be looking to log in this afternoon or know somebody, please know that we're just going to be doing this one time today. And I certainly apologize for that. For those of you that are coming on to get CEUs, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. Those are the two jurisdictions we are set up to provide CEUs for. But I've had many people get the certificates and use them for other licenses within Texas and outside of Texas. But please know you're more than welcome to go through and do that, but there's no guarantee whether they'll take them. We are only set up with these two inside of the state of Texas. We're also offering certificates of attendance. The rules or guidelines for those are the same as the CEUs. Today's webinar will be worth 1.5 hours of CEU credits. In order to qualify, you must attend the entire live webinar. You must also complete the Google evaluation form. That should pop up as you close out of Zoom today. If it doesn't, please no concern. I will also be sending that out to you in a follow-up email as well, that link. The Google survey will be good actually until 1 week from tomorrow at 5 p.m. And then give me about 3 weeks to get those certificates out to you. I am behind on last month's, and I'm working on trying to get caught up. So please bear with me, but we will get those out. So with no further ado, I'm going to actually turn it over to Melinda Gardner, and let her introduce Felicia and Angel.
Thank you very much, Marty, and thank you for coordinating the Medicare Mondays. As I mentioned earlier, this is our last one for a couple of months, and we will be starting up again in August. I do want to introduce Felicia Warner, who is a benefits counselor, and Angel Hanzik, who is outreach specialist with the Texas Senior Medicare Patrol. And she'll, I'm sure, introduce herself a little more later, but we're going to go ahead and get started with Felicia.
Good morning, everyone. My name again is Felicia. We are the Area Agency on Aging of North Central Texas, a program of the North Central Texas Council of Governments. We are also known as SHIP, which I'll explain that shortly, but we partner with the Texas Senior Medicare Patrol to provide information and on fraud and abuse, and we're of course co-presenting today with Angel. Good to see you, Angel. So the next slide is our SHIPs are federally funded, and the SHIP program was established by Congress, and their work is funded through the U.S. Administration for Community Living in the U.S. It's at the U.S. Department of Health and Human Services. And our SHIP Health Insurance Assistance Program provides, we at SHIP provide unbiased help to Medicare beneficiaries, their families, and caregivers. Working with state offices, local agencies, and community providers, SHIP establishes community-based programs, networks for counselors who provide in-person and help for our beneficiaries, and on the phone, and we make group presentations, and we use a variety of media sources to help educate people about Medicare. When someone calls us, or when a beneficiary contacts their local SHIP, a certified counselor will give them a one-on-one guidance based on their unique situation and their needs. SHIP helps with understanding costs, coverage, and comparing options, and really helping them complete the enrollment process. So we do a lot, and we'll talk more about that. We'll go to the next slide. The SHIP TA Center serves as the central source of information and expertise and technical assistance for the grantees that contact them. They disseminate knowledge and the best practices through development of new products and tools, and provides one-on-one assistance to the network. And roughly 40% of our contacts occur during open enrollment, which we know as is October the 15th through December the 7th, and that's our busiest time. So if you would like to partner with us, please reach out to us as soon as possible so we can assist you. Go to the next one. And this is just a little SHIP snapshot. There are 54 SHIP grantees in all 50 states. There's one in Puerto Rico, Guam, the District of Columbia, the U.S. Virgin Islands, which I've not been to, but I really want to go. The SHIP services are delivered by the state units on aging, or as would say, the State Department of Insurance in partnership with their local area agencies on aging and other community-based partners. Nationally, SHIP oversees over 2,000 local programs. We have over 12,000 counselors, and 4 million individuals have been educated, and 2.5 million counseling sessions. We'll talk, Angel will talk more about this. We partner with the Senior Medicare Patrol, the SMP program services, which help Medicare beneficiaries detect and report healthcare fraud, errors, and abuse. And SHIP, we recruit and train volunteers. We provide program services to really help people understand what our programs are all about. The SHIP team members are certified, of course, and they're trained. And we go through the coverage with Medicare, such as Original Medicare, Medicare Advantage, the prescription drug program, the supplement, the Medigap plans, and any others. And we'll talk more about the Medicare Savings Program and the extra help to help reduce or help pay for your healthcare costs. We'll go to the next slide. And this is a little video on volunteering. And I started as a volunteer, and it's really been a very rewarding time for me.
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer, and I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, The SHIP program may also be known by one of these names.
That kind of jumbled a little bit, didn't it? Hello? We're on the North Central Texas Council of Governments, our other volunteer opportunities. And some of our volunteer opportunities are the Senior Medicare Patrol, the Long-Term Care Ombudsman Program, the wellness programs, such as A Matter of Balance, and that is helping manage concerns about falling, and our Tai Chi for arthritis. And again, that's with fall prevention programs. Taking control of your health and self-management. I've gone through that course with my husband, and the ladies who conduct those classes are absolutely fantastic. And if you have, if you need to self-manage some chronic health issues, that's the program to attend. It's really good. So we'll go to the next slide. Medicare savings programs. And we'll talk about getting help paying for Medicare Part A and B. Medicare enrollment periods for some people, you know, you're automatically enrolled and that type of thing. If you're on Social Security disability for 2 years, you are automatically enrolled. But this year, starting in January 2023, there were several changes to the Medicare enrollment periods, including the prescription drug coverage in Parts A and B. So we'll go to the next slide. What the objectives? What are the Medicare savings programs and how to qualify for the Medicare savings programs? The Medicare savings programs help pay for your Medicare costs if you have limited income and savings. Very important. Some of the additional benefits of enrolling in the MSP programs include the following. You enroll in Medicare outside of the usual enrollment period, and you can eliminate that Part B late enrollment penalty if you have one, and automatic enrollment in the extra help programs. We'll go to the next one. Poverty is pervasive in Medicare. And this is just a few of the stats. And if you want to research further, you can. In 2021, 13% of Medicare beneficiaries, that's over 7 million, are living under the poverty line. And those, the 19.1% of Medicare beneficiaries, and that's over 10 million, who just live above the poverty level. And that's the people we want to outreach to help them understand that they can apply for some of these programs that can reduce that out-of-pocket cost for them. So we'll go to the next one. Far too many people with Medicare have trouble, and we know this, affording their health care coverage and care. This is one set of programs that can help people pay for some of those costs, and that is the Medicare Savings Program, MSPs. The estimates that enrollees will save at least $1,979 in Medicare premiums in 2023, as well as those individuals that struggle to pay those premiums and may not have learned about qualifying for some of these programs or even enrolling in some of the programs. MSPs pay a monthly Medicare premium on behalf of the people with limited resources and may help with cost sharing as well. Some states are very strict, and in many states, you know, that's low. They're not as strict, but even for those who qualify, the MSP enrollment process can, sometimes it's notoriously complex. And this, is likely contributes to people not, it's under enrollment and people not knowing about these programs. At least it's estimated there are at least 40% of those are eligible, and people, it's like 2.5 million people are not enrolled, and they will continue to struggle with their healthcare costs. So go to the next slide. The Medicare savings programs offer significant benefits. They provide financial assistance for Medicare premiums. In some cases, pay cost sharing for medical services covered by Medicare for eligible low-income seniors and adults with disabilities. Almost 9 million low-income seniors and adults with disabilities receive financial assistance from the federal Medicare Savings Program in order to facilitate access to health benefits under Medicare. Of course, the MSPs are administered by the state Medicaid program, and there are 3 major programs: the Qualified Medicare Beneficiary, the Medicare Beneficiary, and the Qualified Individual. And we'll go through each one of those, and we'll talk more about those. So we'll go to the next slide. And here they are, the 4 Medicare savings programs. The Qualified Medicare Beneficiary, we'll refer to that as QMB, which is unlike QI, which is the Qualified Individual, and the SLMB, and I know that's a lot, but the QMB does not offer retroactive premiums reimbursement. Instead, the federal law prohibits Medicare providers from billing you if you are enrolled in QMB. This means Medicare providers should not bill you for any Medicare coverage services you receive. Additionally, if you have to pay Part A premiums because you do not have 10 years of documented work history in the U.S., QMB will pay the Part A premium for you. The Specified Low-Income Medicare Beneficiary is SLMB, and I have trouble with these acronyms. If you are enrolled in the SLMB program, you may receive up to 3 months of retroactive reimbursement for Part B premiums. Unlike QI, the Qualified Individual, we'll get to that one, you may be reimbursed for premiums from the previous calendar year. For example, if you submitted an SMP application at the end of 2023 and you're approved for February of 2024, you may be reimbursed for those premiums paid in November and December of 23, as well as January 24. The Qualified Individual, if you are enrolled in QI program, you may receive up to 3 months of retroactive reimbursement for Part B premiums deducted from your Social Security check. And also note that you can be reimbursed for premiums paid up to 3 months before you receive your SMP effective date within the same year. So these programs, and I'm just going to go explain a little bit more, that the Qualified Medicare Beneficiaries, the QMB, and pays for enrollees' Medicare premiums. And the QMB is a more generous program because it pays for required cost sharings for your medical service covered by Medicare. And however, it's known that not all low-income seniors and adults with disabilities are eligible for MSPs, but are enrolled in other programs. So these programs are so beneficial to individuals with low income and disabilities, because it helps pay for these premiums. And I know it's $164.90, but that might not make a bunch of difference to some people, but for others with a limited income, that's a nice chunk. So we know that these programs are working, and they are for our low income individuals to help with cost sharing. So it's really important that we get the word out about those programs. And then we'll go to the next slide. The Medicare savings programs, of course, we know they're underutilized, and how meaningful they are. And it's almost talking to people one-on-one, and hopefully they'll tell someone that, yes, I'm saving by filling out this application for the S&P program. Then we'll go to the next slide. And people in Medicare savings program often lose coverage. Of course, eligibility factors, of course, like income and assets and functional status, are relatively stable over time for dually eligible individuals. But still, eligible individuals still experience high rates of being on and off Medicare because of some of these factors. We'll go to the next slide. The Medicare savings programs. In all states, the following income is not counted: the first $20 of all income, the first 65 of your monthly wages if you work, food stamps. In addition, some states disregard or exclude other income, such as the cost of certain health insurance like Part D premiums. In some states, eligibility limits may be higher if there are more than 2 people in the household. But in all states, the following assets are not counted: your primary house, your car, one car, household goods, burial spaces, burial funds up to $1,500, life insurance with a cash value of less than $1,500. Go to the next slide.
I'm sorry, Felicia, I'm having trouble with my advanced. Which slide are you on?
Okay. I am on 16. I'm sorry. I apologize. We're there?
On the requirements?
Yes. Below are the general requirements for S&P.
Thank you.
Thank you. I'm sorry. We got off track here. So the Medicare savings program, of course, we went over, and then I'll go over it again. The first $20 of all income, the first $65 of your monthly wages, food stamps. In addition, some states may disregard or exclude other income, such as the cost of certain health insurance premiums like Part D premiums. In some states, the eligibility limits may be higher if there are more than 2 people in the household. In some states, the following assets are not counted, such as your primary house, one car, household goods, burial spaces, burial funds up to $1,500 per person, and life insurance with a cash value of $1,500.
Okay, I may have a different slide than you. I'm on the below our general requirements for the MSP.
Mm-hmm. Yes. Reside in the state. Yes,
Yeah,
that one. Mm-hmm.
Okay,
yes.
Thank you.
I was just giving a little detail. I'm sorry. Okay, we'll go to the next one. We'll get on track. The Medicare Savings Program Financial Eligibility Guidelines. And as you can see there, the qualified Medicare beneficiary QMB, the specified low-income Medicare beneficiary, SLMB, the qualifying individual, QI. And there is also another one not really on here, but we'll get to that, the qualified disabled working individual. And this is a less common Medicare savings program, but it's administered by each state's Medicaid program, and it pays the Medicare Part A premium for people who are under 65, have a disabling impairment, but continue to work, but and are not otherwise eligible for Medicaid. So that's the QDWI, qualified working. Oh, Melinda, help me out. This individual, the QDI, I forget that acronym.
Yeah, QDWI, qualified disabled working.
Working.
Yes.
Thank you. So here's the more details on that, and these are all provided on the slides that are available to you. And the next slide, and of course the Medicare Savings Program is not the same as the Medicaid Estate Recovery Program. We're all familiar here in Texas about the spin down, where if you receive Medicaid for long-term services and supports in the state of Texas has the right to ask for money back from your estate after you die. So the MSP programs do not do that. And we get to how to apply for the Medicare savings programs. You are eligible if you have Part A. Your income for 2023 is at or below the income limits listed. For any of the programs, you have limited resources. And a general guide to the application is you can call our office or you can call the local Medicaid office and submit your application. You can do it online through yourtexasbenefits.com, and you can mail in that, or you can have an appointment at the office or at a community center, or you can call us and we can help you submit that application. And some examples of the documents required, of course, you must include in your application is your Social Security number, your Medicare card, your passport, green card, or birth certificate, proof of your address, utility bill, phone bill, proof of income, your Social Security award letter, pay stubs if you're working, and information about your assets through your bank statements, stocks, life insurance policies. Remember, again, that your application requires this documentation, and it varies state by state. Before submitting your application, be sure to make a copy of what you have submitted, and then submit it to the office, or you can send it to us and we will submit that application for you. And that application process takes about 45 days. You'll get a notice of action letter within that time, and it'll inform you of the status of your application. And also remember, if you receive a denial letter and are told that you do not qualify for MSP, you have the right to request a fair hearing to challenge that decision. If you are found eligible for SLMB or QI, the state will pay for your Part B premium starting the month indicated on the letter. But remember, it can take several months for that to happen, and they will still deduct the $164.90 back out of your check, but it will be added back to your Social Security. You should be reimbursed with a lump sum check for the month that your premium should have been paid. So we'll go on to the next slide, which is extra help with Part D drug costs. Extra help, and how to qualify for extra help, and your continuing eligibility. So what is extra help means? Extra help means Medicare helps pay for your Medicare prescription drug coverage, monthly premium, yearly deductibles, coinsurance, and co-payments. If you have limited income and resources, you can get extra help paying for your Medicare prescription drug costs. Extra help is also called the low income subsidy, LIS. If you have the lowest income and resources, you'll pay no premium or deductible and have small or no copays. If you have slightly higher income and resources, you'll have reduced deductible and pay a little more out of pocket. If you qualify for extra help, you won't have a coverage gap or late enrollment penalty. You'll have continuous special enrollment. You'll have a continuous enrollment, and you can switch plans at any time with a new plan going into the next month, the first day of the next month. So go to the next one. So again, that's you pay a reduced deductible and a little more out of pocket, no coverage gap or late enrollment period if you qualify, and a quarterly special enrollment period. And the limited income and resources that you get help with paying your, get extra help paying for your Medicare prescription drug costs, that's also underutilized program also. When you sign up through the Medicare Savings Program, they'll determine if you qualify for this also. Go to the next slide. 2023 extra help income and resource limits. Your income limits must be below 150% of the federal poverty level. And that's $1,843 per month for individual, $2,485 for a married couple. If you're married and live with your spouse, both of your incomes and resources count. Only if, and this only applies if you are applying for extra help. If you are married and don't live with your spouse, you can apply. The only your income and resources count. The income for a single or a married person is as appropriate, and whether you live with your spouse or not, or you have dependent relatives that live with you and rely on you for at least half of their support, is also taken into consideration. This means that if a grandparent is raising grandchildren, they may qualify, but the same person might not have qualified as an individual living alone. And only two types of resources are used to see if you're eligible for extra help. Liquid resources such as your savings account, stocks, bonds, or any other assets that can be changed into cash within 20 days. Real estate is not included, your home or land in which your home is located. And even things like heirlooms aren't counted. So we'll go to the next slide. And again, extra help for income and resource limits. The resource limits are up to over $16,000 for an individual, $33,000 for this is for a year, for a married couple. And it doesn't include the $1,500 per person for your funeral or burial expenses. And it counts the savings and investments, real estates, except your home, and vehicles above one, just one. So we'll go to the next slide. qualifying for extra help. You automatically qualify for extra help, and you don't need to apply if you have Medicare and get full Medicaid coverage. Supplemental Social Security income benefits, or help with Medicaid, paying your Medicare Part B premiums. If you don't meet any of these conditions, you may still qualify for extra help, but you'll need to apply for it yourself, because you're not automatically enrolled. If you think you qualify and aren't sure, you should still apply. That's my thoughts to people when they tell me their income, and then they tell me what they're having to, pay out of their income. If you're not sure, let's still go ahead and apply. And you can apply for extra help at any time. And if you're denied again, you can reapply if your circumstances change. Eligibility for extra help may be determined by either the Social Security office, Social Security, or your state Medicaid agency. And we can also at our office help you with that. So we'll go to the next slide. You automatically qualify for extra help, but you can apply online. You can call Social Security office and ask for an application to help with Medicare. You can contact your Medicaid agency, or you can call your local SHIP office, which is us, to apply for those. And the next slide shows the automatic and facilitated enrollment. So full Medicaid benefits, you can automatically qualify, the state Medicaid agency, an automatic enrollment in Part D, and then the type of letter you'll get and your continuous special enrollment periods. So we'll go to the next slide. And Medicare limited income for the newly eligible transition net program. And Melinda might have to jump in here a little bit and help me explain this one, because I've not dealt with this a whole lot, and I'll freely say I don't know. But this program is designed to remove gaps in coverage for low-income individuals moving to Medicare prescription drug coverage, and enrollment in Medicare's limited income. This program is temporary and ends once a low-income person with Medicare gets coverage through the Medicare drug plan. The program gives a point-of-sale coverage to people with extra help who don't yet have Medicare drug plan. And it also gives retroactive coverage to people who have full Medicaid coverage or get supplemental security income. So Melinda, would you like to add anything to that?
No, that's good. You
Okay.
covered it.
I don't want to miss anything. I don't want to leave anything out. But
Yeah. It's a temporary program.
Temporary
in case
program.
someone does not have coverage and they are low income. At the pharmacy counter, they're able to use this program to get those reduced costs. Mm-hmm.
Good.
Thank you.
Don't want to leave that out. Thank you. And again, this is a little bit more information on that program, the Medicare's limited income net program. The open formulary and doesn't require prior authorization, includes standard safety and abuse edits to protect you from refilling too soon or therapy duplication. It has no network pharmacy restrictions, which is good. So we'll go to the next slide. And how do you access this? There are 3 ways you can access this program. Auto enrollment by the Centers of Medicare and Medicaid. they can enroll you. If you have SSI benefits, you're not automatically enrolled if you get help from the state Medicaid agency paying your Medicare Part B premiums, the SMP programs, or have applied and qualified for extra help. So that's some of those little small restrictions, but this is an excellent program. Oh, I might want to add on the slide. If you have to pay, if you pay for it, you can submit you may submit pharmacy receipts and not just the cashier's receipts to be paid, reimbursed. So that's a good thing to pay for your out-of-pocket expenses during this eligible period where you're waiting. So there are some changes in qualifying for extra help. Every August, Medicare reestablishes extra help eligibility for the next calendar year. If you automatically qualify, your extra help continues or changes depending on whether you're still eligible for full Medicaid coverage and get help from the Medicaid Office for paying Medicare and premiums or supplemental security income, SSI, and any changes go into effect the following January. If you were automatically eligible in a year, then you can continue to qualify for extra help through December of that year. If you become no longer eligible, your automatic status ends December the 31st of that year, and you will no longer be automatically qualified for extra help. And you'll get a letter from the Medicare, or as they call a gray paper, with the extra help application from Social Security. And you'll get that, and of course you'll need to take care of that right away. When people are no longer automatically qualified for, and they need to regain their eligibility for full Medicaid coverage, the Medicare office Medicare will mail them a new letter on purple paper informing them of how they need to automatically qualify for extra help. So we can help with that. If you are confused about that, you just call our office or the Medicaid office. Okay, we'll go to the next slide. And there's just stating some more changes to that and the color of the paper that you receive. They really like different colors. So we'll go to the next slide. The redetermination process. People who applied and qualified for extra help, there are 4 types of redetermination processes. It's the initial, the cyclical or reoccurring, the subsidy changing event, or other event changed. The redetermination, to redetermine eligibility, Social Security selects a group of people who are eligible for extra help, but their eligibility may have changed due to some circumstances, and they'll get a redetermination form. And the cyclical or reoccurring redeterminations each year, Social Security Administration selects a random group of people with extra help to redetermine their eligibility for the following year. These people will get a redetermination form in the mail in September. They must complete and return the form within 30 days of receiving it, even if nothing has changed, or SS or the Social Security Administration may end their eligibility for extra help. So anytime we have a client that gets something in the mail, they do need to respond. And the subsidy changing event, people with extra help may experience events that change how much extra help they can still get, like marriage, divorce, separation, annulment, or death of a spouse. They're required to report these events and complete and return the redetermination form, or they may lose their eligibility. So any changes must be reported. And even other events, it affects your eligibility for extra help, and can be redetermined by the Social Security Administration office. So thank you so much for bearing with me through this. It's a lot of information, I know. We are here to answer those questions, and my number is listed here. This is the toll-free number if you have questions about the Medicare Savings Program and extra help. Thank you so much. Thank you, Melinda. Thank you, Marty. Angel.
I guess that means you're up, Angel.
All righty. Well, then I'll just go ahead and take over then.
I just gave you access.
Okay,
Awesome.
great. Thank you so much. And thank you so much, Felicia. It was wonderful information. It's going to be hard to follow that one up, but I hope that everyone really, honestly. Okay, well, thank you so much. I am Angel Hansick. I am the outreach specialist with the Texas Senior Medicare Patrol, a program under the Better Business Bureau's Education Foundation. And I am so excited and thankful to be here with you today to talk about durable medical equipment fraud. Anytime you have any questions, please throw them in the chat or in the Q&A function, and I will be sure to get to them either during the presentation or at the end. All righty, let's jump into it. Maybe. There we go. So first and foremost, what even is the Texas Senior Medicare Patrol? We've talked about it a few times today, but what even do we do? So first, we are a federally funded program. So it's all completely paid for so that we are able to provide a free service. There is one of us in every single state. So just like the ship, we are specific to Texas. However, we are in every single state and the U.S. territories. Felicia, I will be joining you in the U.S. Virgin Islands whenever you go. So just let me know. But what we do here is we recruit and train volunteers and professionals about Medicare fraud and abuse so that they can go into the community and educate others so we can try and prevent the amount of waste in the Medicare system. And then we are also a reporting agency. So you can call us completely toll-free and report any sort of Medicare fraud or abuse that you are seeing, suspected fraud or abuse. And then we help gather that information and send it to the correct fraud control units, because it's not just Medicare who handles improper claims and fraud. It can go to a much larger scale, all the way up to the FBI, okay, because fraud is a crime. Right. Next. So our mission here at the Texas Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So a big, beautiful mouthful to say that we talk about Medicare fraud. That is our forte here. So what even is fraud, error, and abuse? So, because there are differences, that there's nuances whenever we're talking about waste in the Medicare system. So first, errors, accidents happen. At the end of the day, there is a person on the other side of that computer screen, typing in those codings, writing those prescriptions. And so this is an unintentional mistake, complete human error, typically an easy fix. Abuse is whenever these errors have become so repetitive that they become basically systematic. So it is now every single time that they're coding a blood test, instead of coding 1, 2, 3, they code 1, 2, 3, 4 every single time. And so it is still an error, but it is abusing the system, and it does contribute to a lot of waste. Now, fraud, on the other hand, this is the intentional misuse of information to obtain payments or services. Okay, so I know that I am not Marty, but if I go and I say that I'm Marty and I use his insurance information, obviously I am aware that this is wrong, and so that assumes criminal intent, and so that's whenever legality steps in. Oop, oop, everybody pretend like you didn't see that. It was supposed to be a surprise. But what is the impact of Medicare fraud? What is the weight of this waste that we're dealing with? So every single year, Medicare loses billions of dollars to this waste, to Medicare fraud, error, and abuse. And I just want you to throw in the chat, if you didn't already see the sneak peek, throw in the chat how much money you think is lost in a single year to Medicare fraud. Any number is totally fine. Any guesses are appreciated. And while y'all are doing that, I just want to let y'all know that there are approximately 250,000 Medicare beneficiaries who have had their medical identity compromised. So that means their Medicare number is being misused in some way. All right, so I see in the chat, 5 million, 1.5 billion, 50 million, and 90 billion. So far, our closest is 90 billion. The actual number is actually $60 billion. That is how much money is lost in one single year to Medicare fraud, error, and abuse. So that is a huge number. I know I see some millions in there, and unfortunately that is so low, right? It's actually 60 billion, and that's just an estimation. Of course, there's no way for us to have an exact number of the amount of money lost to fraud because it's not all reported. We're not aware of every single case of fraud or abuse that is happening. And that's why it's so important for us to report it so that we can keep track of it and send correct units to go ahead and create task force to stop this fraud. So why do I care? That's Medicare's money. It's not my money, right? But unfortunately, yes, that is our $60 billion that is being lost because Medicare fraud, error, abuse, it affects everyone. Those are our taxpayer dollars that are being lost to these improper claims. So if anyone has $60 billion that they're okay with going to waste, go ahead and just send it to me. I'll put my information in there and you can go ahead and send me $60 billion. But yes, and unfortunately, it also puts the Medicare trust fund at risk. So with $60 billion being taken out every single year of the system, that is a lot of money being lost, and it creates an unstable foundation for a program like this. And so you might not be on Medicare right now, but maybe 5, 10, 20, 30 years, you want a program like this to still be around. I know that I want to benefit from a program like this, but unfortunately, with so much money being lost, it creates an uncertain future. And then, of course, the people who are being affected the most are Medicare beneficiaries. With this money being lost, it raises their monthly premiums. So there's more money that you have to pay each month. There's less money in the system for your needed benefits. And of course, it's affecting your quality of treatment. I always ask, do you want to go to a fraudulent provider? And that's usually met with a lot of laughters and a lot of head shakes because no one wants to go to a fraudulent provider. Okay, that if they are willing to scam you out of money, who knows what kind of treatment that you're going to be getting. And so today, this is the nitty gritty of what we're going to be getting into is DME scams, or durable medical equipment scams. And so this is just one of the ways that we're seeing fraud, error, and abuse. However, of course, there's a multitude of different ways, but this is a big one that we've been seeing in the past year. So what even is DME? What counts as durable medical equipment? So durable medical equipment is supplies that is prescribed by your doctor that can withstand repeated use. So it's not just a use one time, throw away, Band-Aids don't count as durable medical equipment, but they have to serve a medical purpose and can be used in the home. So some outrageous thing like a wheelchair van or something is not necessarily durable medical equipment because it is not used inside of your home. Medicare is only going to cover this durable medical equipment if you get it from a supplier in a Medicare, enrolled in a Medicare program. So make sure that your supplier has a contract with Medicare. This is covered in your Medicare Part B plan, which typically covers that 80% of the approved amount. But of course, if you have those Medigap or supplemental insurance, or what Felicia was talking about earlier, the savings programs, this might not always apply. So just some quick examples of what durable medical equipment may be. And if you don't see something on there, go ahead and throw it in the chat. Throw me in some extra examples if you can think of it. But some examples of durable medical equipment may include blood sugar monitors and test strips, crutches, hospital beds, oxygen equipment, walkers, wheelchairs, scooters, any sort of mobility equipment, or orthotics. That's always a hard word for me. Okay, so we're talking about back braces, knee braces, prosthetic devices, such as breast prosthesis, cochlear implants, and things of the like. So once again, can withstand that repeated use. It's meant to be used multiple times. And so now let's actually talk about the scams that we're seeing. How are they actually defrauding people through durable medical equipment? So one is suppliers who are offering free, quote unquote, equipment, but they're billing Medicare. So first and foremost, I just want to let you know that nothing is ever going to be free. There is very, very few things in this life that are free, and medical supplies, unfortunately, is not one of them. And so if they are offering something as free, but asking for your Medicare number, obviously that is not free. That should be a red flag. Okay, someone is paying for that. Okay. Next is suppliers who want you to use only their doctors and not your own. This can be a huge red flag because then they can prescribe you unnecessary medical equipment. If they want you to use only their doctors specifically, they can have certain contracts with those doctors where they actually get a commission for however many different things that they prescribe to you. And then they're both making money off of you for supplies that you don't actually need. Okay, so that is another red flag. Your doctor should be completely sufficient. Any doctor should be able to prescribe you equipment that you need that you can redeem with a Medicare DME supplier. Next, we have suppliers or doctors who provide medical equipment or supplies that you never requested. So unfortunately, this is a big one that we're seeing. It's one of the most common ways that we see this Medicare fraud in this sense. So please, any sort of doctor who had never prescribed you anything or prescribing you equipment that you don't necessarily need. So if you're not diabetic and they're prescribing you glucose monitors and you start receiving shipments of those types of things, please, please, please beware. This is the #1 scam that we're actually seeing in this year is diabetic supplies scams. So where people will start being charged for diabetic supplies, such as those test strips and those glucose monitors, where they'll have them show up at their door and being charged on the Medicare, but they are not actually diabetic. And so that is why I cannot stress enough, please, please, please read Medicare summary notices and your explanation of benefits or whatever statements that you're getting from your insurance, because that is the best way for you to actually detect what is going on with your Medicare claims. Okay, so unfortunately, that is super, super common. And a lot of times people just think, okay, free equipment showing up at my door. I didn't pay anything. Sure, Medicare paid out. But free stuff for me, I might use it later. I can give it to a friend. No, this is fraud. And I really, really encourage you to send it in. And also you may actually end up having to foot the bill. Okay, if Medicare does see that you actually are not qualified for that product that you're receiving, or if you've received too many of a type of product, Medicare won't continue to cover it. So if you get maybe a wheelchair or a walker in the mail and you're like, okay, nice, well, free equipment. Well, now you're in the system as already having received that. And so in the future, if unfortunately you do have to receive a wheelchair, it is already in the Medicare system that you have received one and they won't cover another one. And so you'll have to pay out-of-pocket costs later on. So any sort of unsolicited or non-requested supplies that you're getting, please send it back immediately, dispute that claim. Don't let that stay on your Medicare claims. Next, receiving charges for items that you never received. Okay, and so that's the flip side of it, is we're actually seeing a lot of people who do have diabetes who are being charged for multiple glucose test monitors and multiple test strips, much more than they ever receive or could even use within a month's period or a year period. And so they're being charged for that, but they're never actually receiving those items because these scammers, these fraudulent providers, they think, well, they're just not going to notice. They're already being charged for these types of supplies. So they'll never notice if we just charge them for a few dozen more. So please, please, please look at your Medicare summary notices for those things. All right, so this is DME fraud schemes continued. Suppliers who bill for people who have already passed away. Unfortunately, this is something that we are seeing as well. Please, if you have a recently deceased family member, please make sure that you check their statements after the fact, just to make sure that no one is using their Medicare number and billing them for services. We have seen this quite a lot with people who are in hospice or people who have recurring like shipments for things. So if you do get those diabetes test strips every single month, and someone passes away, they'll continue charging for it and sending supplies that they obviously cannot use or receive. And so please be checking those Medicare summary notices. If anyone ever requests your Medicare number at a presentation or at a sales pitch or in an unsolicited phone call, absolutely do not share that information. Okay, please only share your Medicare number with a trusted Medicare provider. So your doctor that you're seeing, not just someone that is at perhaps a health fair. Okay, please, please, please do not share that information because you have no idea what they're going to do with it or if they're even a legitimate provider. Anyone who contacts you unsolicited, do not even pick up the phone is what I encourage you to do. Just let it go to voicemail. If they are a legitimate person or company or your doctor, they'll leave a voicemail and you'll be able to call them back. But please, anyone who contacts you unsolicited, do not share any sort of personal, private, or financial information over the phone. Also, beneficiaries who willingly allow their Medicare number to be used in exchange for money, gifts, or unnecessary supplies. So this is called a kickback, receiving kickbacks for sharing your Medicare number. This is illegal. This is fraud. Please, please, please do not do that. Do not use your Medicare number for prize drawings, or if someone offers $300 to use your Medicare number, please do not accept this. This is completely illegal. And then also, this is a big one as well. Suppliers who deliver an off-the-shelf product, but bill Medicare for a more costly product. So we actually had a pretty humorous case about this a couple of years ago, where a man received an unsolicited phone call from a DME supplier, quote unquote, and they were screening him. It was a phishing call saying, "Hi, you're covered for such and such through Medicare. Do you have back pain? Do you have arm pain? We sell braces. It's completely free through Medicare, et cetera, et cetera." And he was like, "Oh, well, actually, yeah, I have quite a bit of knee pain. I have trouble walking. I would love to receive, my free knee brace." And so they went ahead, charged it to Medicare, and he did receive a brace in the mail. However, it was an extra small hot pink knee brace with butterflies on it. And so it was something for a little kid. And of course, this was a grown man on Medicare. And so it did not fit. It was not the right product. A child's brace is obviously much cheaper than a brace for an adult. And so they were charging Medicare, however much money, let's say $100 for a brace that they actually could charge $10 for. And so please watch for this as well. If you are receiving low quality products for a high quality product price in Medicare, please go ahead and report that. So how can I actually stop this DME fraud? What should I be doing? First, please ensure that your doctor has assessed your condition and is the one that is ordering or prescribing those equipment or supplies. Okay, someone at a health fair, some random salesman, they They are not qualified to assess your condition and ensure that you have the proper equipment that you'd need. Okay, also please never sign a blank form from any healthcare provider or equipment supplier. You want to know what you are signing away for, okay? If they say, don't worry, we'll fill it in later, just put your signature and your number on it and we'll make sure everything is in line. No, go ahead and say, no, I'd like to see everything, let's fill it out now, or we can come back and do it later. Because you don't want them to put things on there that you are not consenting to. Also, please always check your Medicare summary notices, your explanation of benefits, any sort of statements that you're getting from your insurance. Please, please, please read those, okay? If you are renting or returning medical equipment, always get a dated receipt, okay? So that you're being charged for the exact amount of time that you actually had that equipment. And they can't just keep charging you for more and saying, oh, well, you know, we got it back 3 weeks later. Well, no, my receipt here says that I returned it on the correct date. So please keep that documentation. Protect your Medicare, Medicaid, Social Security cards, keep them all in a safe place. We encourage you don't carry it with you whenever you're just going out for a walk or going to the grocery store. Only take those documents with you whenever you know that you're going to need them. Okay, keep them in a safe place at home. Also, don't accept products or services from strangers who call or knock on your door. Any sort of person who is contacting you unsolicited should already be met with suspicion, please. Don't give out your Medicare number at presentations or during sales pitches. Obviously, they are working for a commission. As many Medicare numbers as they can get, the better, because they're making good money off of it. And please do not accept money, gifts, or unnecessary equipment or supplies in exchange for your Medicare number. Those kickbacks, please, please, please do not fall for it. Especially if it sounds too good to be true, it definitely is. Okay, so please be wary of that. We ask that you follow these 3 steps to combat Medicare fraud, which is prevent, detect, and report. That's kind of our catchphrase here at Texas Senior Medicare Patrol. So first is prevention. Of course, the easiest way to handle Medicare fraud is to prevent it from happening in the first place. So please treat your Medicare number like you would your credit card. Don't share that information with anyone except for your doctor or Medicare provider. Don't carry around that Medicare card. Know that Medicare is never, ever going to call you. They are not going to call you. They don't have the time or the resources to be calling every single beneficiary. Any sort of offer for a free medical service, that word free should always set off red flags. Watch out for identity theft, any sort of tactics that you are employing to protect your identity, your regular identity. Please use it as well for your medical identity. And of course, share this information. Dissemination is so important, sharing this information and just ensuring that the more people who are educated on Medicare fraud, the more likely that we will be able to protect ourselves from it. Next is detect. And so once you've done all your prevention steps, how do you actually know if something is going on? So we can detect by using our Medicare summary notices or your explanation of benefits. Please read over those just every time you get it, every 3 months or however often you're receiving them. Sit down and just review them for any services that you did not receive. You're looking for double billing, being charged twice for the same service, or any services that were not ordered by your doctor, but you were provided and charged for. Okay, you can access this information through Medicare.gov. So they do have your Medicare summary notices online. So if you already threw those Medicare summary notices away, that is okay. You can go online and find that information. And we do ask that you use your personal health care tracker. So this is a free resource that we give out here at Texas Senior Medicare Patrol. And it is a personal journal for you to use. It's about billfold size, and it has prompts on there that say what date your appointment was, what doctor you saw, and what services were actually provided. So that whenever you get your statements, you have your own personal record and you can go back and cross-reference between the two to ensure, hey, I actually didn't see Dr. Jones that day, so I'm not sure why it has that on there. Okay. If you're interested in receiving one of these healthcare trackers for either you, any residents that you manage, your team, anything like that, please go ahead and give me a call, send me an email. Any of the lovely panelists here today have my information, and they can get you over to me. And we do offer it in multiple languages. So please just contact me and let me know if you would like to receive one of these. We ship them out completely free of cost. Okay, and so you saw something weird on your Medicare summary notice, and now what do? That's step 3, that is report. We ask that you call the provider, say, hey, I see something weird, what is this? Because remember, human error exists, accidents happen. Call them and say, hey, I see I got charged twice for this blood test, what's going on? And either they'll assist you super quick, easy peasy, or they might start giving you trouble. I'll say, actually, no, it's supposed to be like that. No, we can't help you. Oh, no, you did get multiple tests that day. Go ahead, gather the information, your Medicare summary notices, any bills you received, and contact the Texas Senior Medicare Patrol, and we can help gather that information with you and walk you through the next steps and send you where you need to go. Okay, this is completely free and a confidential service. And so if you've been listening so far, that word free should just set off red flags, and you should be like, no, nothing's free. But as I mentioned earlier, we are federally funded. So this is already paid for by your taxpayer dollars. Thank you so much. And it's completely confidential. Everything is kept within this office, and of course, Medicare. So please utilize us as a resource. If you see anything fishy, please report it. And here's my contact information. I see Marty went ahead and sent that in the chat as well. But you are welcome to reach out to me with any questions that you may have about any sort of Medicare scams, those healthcare trackers, how to read your Medicare summary notices. We can assist with all of that. So please feel free to reach out, and our hotline number is there as well. I'm happy to take any questions now. And thank y'all so much for listening to me.
Real quick, let's advance a slide 1. We'll go over the CEU information real quick. Well, you guys are looking at the Q&A and looking at the chat for questions, if we could. So just for all of you that are joining us for CEUs or a certificate of attendance, we are offering CEUs for licensed social workers and licensed professional counselors in the state of Texas. The CEUs today come through me, and this is who I'm set up to provide CEUs for. As some of you, I know it gets a little bit confusing. Depending on what webinar we do, we offer CEUs for different licenses, and that's because in some cases, our partners that we're partnering with are the ones offering the CEUs, and they are set up with different agencies for different licenses. So you're more than welcome to go through the process and get a CEU certificate. If you are looking for a CEU for something else, you can submit it to them, but please understand that there's no guarantee that they will take it, and there's not anything I can do about that. We're also offering certificates of attendance for anybody interested. Today's webinar for attending is worth 1.5 hours of CEU credits. You must have completed the entire live webinar to qualify. You must also complete the Google survey evaluation form, which should pop up or at least give you the opportunity to go to it as you close out of Zoom today. If it doesn't, no worries. We'll also send that link out in a follow-up email. That Google survey will be up and live till 1 week from tomorrow, and then please give me about 3 weeks to get those out to you. I am behind, and I'm working on trying to catch up. I will say that in going through the people that are on the webinar, I did see 3 or 4 people that were on double, the same person twice. Just so you know, if you're looking for CEUs or certificates of attendance, please make sure you register as yourself and you get on as yourself. Now, if you have a client that wants to get on and they're not looking for anything, you're more than welcome to share your link. But please know that if you're looking for CEUs or certificate of attendance yourself, you need to be on as yourself because that's the documentation we get from Zoom in order to have on our files in case we ever get audited. So I'm going to turn it back over to you all for Q&A.
Thank you, Marty. I did see a couple things in the Q&A. Thank you, Michelle, for your suggestion. I like that, Medicare and more. We will definitely take that into consideration. If someone else has ideas of other webinar names, feel free to put that in the chat so that we can take those into consideration. Can you provide an example for the NET program? Yes, we can. For instance, if someone moves here from another state and they have not switched over their extra help, even though it is a federal program, they may not have switched their address. So there may be an issue with them receiving their extra help benefits. So the LINET program would be available to them. If someone is new to Medicare and they have applied for extra help, but their information hasn't been submitted to the plan yet, but they received their letter from Social Security, they can use the LINET program. Or if someone is changing, again, from one plan to another and it has not taken effect yet, LINET should be available to them. When someone calls in reference to that, sometimes the pharmacies aren't aware of the LINET program. So we may have to speak as a SHIP agency, we may have to speak with the pharmacy, provide them with the codes needed to assist the client with getting their prescriptions at a reduced cost. So those are some examples of using the LINET program.
Someone had asked earlier about, I saw about getting a hold of the SMP program, and I think there's a couple of things. First of all, I realize some of you are watching outside of Texas, and in that case, you're probably going to want to get a hold of your local area agency on aging and possibly ask them how to get a hold of that. I don't know. Do you serve more than just Texas, Angel?
No, so we're completely Texas specific. However, if you do call us looking for a different SMP, we can go ahead and route you to the correct one, or our website has that information so you can find your correct state, or the SMP Resource Center. Thank you so much, Melinda. Oh my gosh, y'all are so quick. Yes, so even if you were out of state and all you remember is my number, it's totally fine. I have it listed on a board right here, I could tell you. So.
And like our area agency on aging, Melinda, your SMP services are just for the 14 counties we serve. Is that correct?
That is correct, right?
Okay.
And if
So
they're
that would
outside of, if they're outside of that, then we will call Angel.
Yeah, okay. So call Angel. I didn't know if the other area agencies on aging are partnered, or if it's just some here and there.
Some of them.
Yeah, some
Okay.
here and there.
So then you're going to be best off calling Angel and getting her help into who serves the area you're in.
Yes, that would be perfect. I am kind of a coverall.
And we actually had a presentation in Plano last week, and Angel was virtual and provided the presentation on reading Medicare summary notices. After some technology issues, everything went great. She was
Nice.
Virtual and the people were in person, and it worked out well. So even if there is no coverage for SMP in that area, there's still coverage because of technology.
Nice.
Yes. Oh my God. A blessing and a curse for sure.
Right.
especially on a stormy day, right?
Yes,
Exactly.
absolutely.
Yes.
It looks like we have another question in the chat. What is the typical response time for connecting with a benefits counselor through SHIP in Texas?
Good question. We are, I guess, contracted to respond within 48 hours. Of course, those are business days, not counting the weekend. So if someone calls us today, we should be responding no later than Wednesday. If you have not received a call within those 48 hours, we suggest calling back. Sometimes if a voicemail is left for someone who's out of the office, then we don't get that information. So that happens very rarely, but if for some reason you don't get a call back, feel free to call our office again. Sometimes people think they're calling our office and they're calling somewhere else. We have had that issue before, but if you are not getting a call back, please give us a call back, because we do try to call back within 24 hours, but we are contracted to call back within 48 hours.
And just so you know, I mean, I know goes without saying, but it very much depends on the time of year. You know, if you're calling, 3 days before the open enrollment deadline, that's going to change things a little bit. So please plan ahead if you're talking about questions you might have during very busy, hectic times.
Right. Thank you very much for that. Yes. During open enrollment, sometimes we do end up letting people know that they may need to call Medicare, because Medicare is open 24 hours a day, 7 days a week. And so if we get to capacity, then we may have to refer individuals to Medicare for plan comparisons or benefits information. We have another question. If someone is at age to receive Medicare, however, has insurance already, medical, and I believe that's dental, do they have to sign up for Medicare? That depends. If the company has at least 20 full-time employees, if that is an employer coverage that you're referring to, if the company has at least 20 full-time employees, then that company would be primary and a person would not have to sign up for Medicare. But there are situations when someone may want to sign up for Medicare, and if the company has less than 20 employees, then Medicare would be primary. So in order for that person to have insurance coverage, they would have to sign up for Medicare.
You want to get some good advice when it gets to that time.
Right.
Let me tell you, because if you do not do it right, there are penalties, and those penalties can last a lifetime, last the rest of your life. We're dealing with my mother and a drug program that my dad decided they didn't need anymore, and now he's deceased, and my mother's having to pay a penalty every month for the rest of her life because he should not have done that. So make sure you get good advice when it comes to time. When it's your time to sign up for Medicare, make sure you get some very good advice.
Right. And it was clarified, TRICARE for life. My understanding, and I can verify, but someone has to have Medicare. If they have TRICARE for life and are eligible for Medicare, in order to keep TRICARE for life, Medicare would be their primary. And so they would need to sign up for Medicare. Good questions. Let me see, are there any in the chat?
Just
How to request a hearing after being denied MSP. What is the time limit to request the hearing? That information should show when the denial is received. I don't remember the exact time frame, but the information should be included in the materials that come with the denial. And someone can reapply at any time. There's actually a form sent that's showing if it's income related or if it's resource related. It breaks it down to show how the income is computed, how resources are calculated, and then it tells you you know, if you want to appeal, you can appeal it and gives you that information. So if someone has a specific question about an MSP, if they have that documentation, you can forward it to your SHIP agency and we can kind of take a look at that together to provide more specific information.
I do want to note as a slide note that, and I know Melinda talked about this earlier before we got started, but we will not be having a Medicare Monday webinar next month in June. We've talked about July.
No July.
And no July. Okay, so for sure, no July, no June. So look for us. You know, we'll be looking back at August, depending on I think funding and that kind of thing. We're waiting to hear on. So there's still some things that are unknown. But if everything works out right, the stars align, we will be back in August to talk about more topics and more things for you all.
Yes. And we're at 11:30. There are a couple more questions. So if anybody does have to jump off, we understand. Wanted to try to get to some of these. And I don't know if I've scrolled all the way up and saw all of them. One question was, how can insurance agents volunteer their time to SHIP? I would suggest giving us a call so that we can let you know what opportunities are available. Because not only do we have volunteers as a benefits counselor or SMP, but then we have those other opportunities through the evidence-based workshops or the ombudsman program. And so there may be something that may better fit what you're looking for, but give us a call and we can definitely talk to you about other opportunities or what you can do through our program.
Did you get to clarify? I serve many patients who are near the poverty line. I don't know if you.
Okay, there it is. I serve many patients who are near the poverty line. If they need help verifying and perhaps learning how to submit for the program in the beginning of the call, which mentioned additional help in covering the premiums. Can they reach out? Oh, definitely. They can reach out to us. We can provide the information on the criteria and the requirements for those programs. We can help people apply for the programs or direct them to the website to apply for the programs. So yes, we can give a call with any questions.
And once again, if they're not in our service area, would they call their local area agency on aging? In general, would that be covered by all the area agencies on aging?
Yes, yes, yes. The benefits counseling program that is through the SHIP, State Health Insurance Assistance Program, is mandated by the Older Americans Act. So each AAA, or I think in Texas, all the AAAs are part of SHIP. In other states, it could be different.
So just so you know, there's a statewide area agency on aging hotline that gets you to the local area agency on aging. And we really want you calling that number, because they keep track of how many calls they get, which helps when it comes time to defending funding for these programs. But that is even under my contact information and my email address. I have that statewide number. I also put it in the chat earlier, and I'll do that here once again. But that would help in Texas to call just the statewide line, and then they'll actually forward your call right to the appropriate area agency on aging.
Yes, and thank you, Marty. That number also is on the back of the Medicare and You handbook. No matter what state you're in, you can look on the back of that book. And it will have that specific state's SHIP number.
Very good.
And if you need a Medicare and You handbook, we are happy to mail those out to you as well.
Very, very good. Very good. So I think that's everything.
I think so.
I think we got everything. Again, thank you, Angel. Thank you so much Felicia, thank you. Melinda, thank you so much for this partnership. And we look forward to seeing you all in August, hopefully.
Yeah.
And until then, be careful, call your SHIP agency, call Angel, make sure you get good Medicare advice. Thank you so much.
Thank you all. Have a great day.
Y'all have a
Thank
wonderful day.
you.
Bye-bye.
Bye-bye.